So we can kickstart. I'm your first presenter. We're going to look at one of those use cases for what we can do with serialization data beyond compliance, and the answer is recalls. So, setting the stage, you heard Shabir talk a little bit about the journey to get to the point we're at today. It actually goes back in time pretty significantly. If we go all the way back to 1987, this was kind of the genesis of traceability. And I needed some notes because I wasn't working at that time. But this was the first law addressing drug diversion and counterfeiting risks, and it introduced the idea of tracking product origin. Fast forward to 2004, the FDA took an initiative where they investigated RFID technology as a solution. There was a big push, and while the technology wasn't ready to scale and it didn't take off, this was novel because it shifted the mindset toward unit-level traceability data. And then fast forward, in the later mid-thousands, we had pedigree. So starting with California ePedigree, and why this was important is because it highlighted the need for consistent standards across systems. And then finally, there's the DSCSA. We know a lot about that. We'll be talking a lot about it today, and beyond. And so we've waited all this time. There's been many developments and iterations, and the data is finally emerging. So what can we do with it? And at TraceLink, we've been thinking about that, but not just what problems to solve, but what are some of the biggest problems to solve. And one clear answer was drug recalls. So drug recalls are ever present. On average, there's 1,300 drug recalls classified by the FDA every single year. And a significant number of those are class 1s, which can pose patient risk. What's interesting is the reason that recalls happen are typically human error. Things like labeling, packaging errors, impurities or contamination, things that happen, right? There's no way to outright prevent recalls from happening. So the mindset that we should go into is, how do we respond? What is the best way to respond, and how can we improve upon the tools that we have to do so? Recalls impact every segment of the supply chain differently, so let's take a minute to appreciate that. On the pharma manufacturer side, a recall is like a doomsday event. It happens very infrequently, but when it does, it creates a lot of fallout. We understand that it could cost, like, I think the number was $2 million in effort and in materials cost just to try to understand the impact of a recall, which could typically be like sending notices or doing manual follow-up with parties that have received the drug. Between medical device manufacturers and drug manufacturers, there's approximately one case every year in the US where one of these companies' stock price drops 10% or more because of a quality problem like a recall. So the impact is massive, and part of the challenge is it's really, really difficult to close out the recall, to know what is the scope of the impact and when is it done. We've heard that it can take literally years for a drug manufacturer to close out a recall in the eyes of the FDA. So they're on the hook with the FDA, they'll need to get it closed out, and why it takes so long and it costs so much is because they don't have tools to understand where can we identify where that recalled product has gone, and once we understand its impact, we can close it out. On the other end of the spectrum, we have our dispensers, the retail pharmacies and health systems. They're basically on the front lines. They purchase such a mix of drugs that recalls are like a daily occurrence. They could get multiple notices in the same day, and obviously they're worried about, like, have we dispensed this to patients? Are patients at risk? They're on the front lines, right? Will I get all my orders? And then the wholesalers are somewhere in the middle. Obviously they purchase a lot of drugs, they deal with recalls all the time, but they're spared from having to deal with the patient impact. And so we want to solve all this, but we're starting where we think we can make the most impact quickly, and that's within the pharmacy. So how we understand it from talking to many of our customers is that recalls are just one of dozens, if not 100 responsibilities that a pharmacist or a pharmacy technician or a buyer could have. They're disruptive too, right? A recall might land on somebody's desk and they have to take immediate action. They might drop what they're doing. This juggling act is quite difficult, and it puts strain on an already strained workforce, where we know in recent years there's been increasing cases of staff shortages or an overlap of responsibilities from pharmacy technicians and pharmacists. So it's a problem worth solving, and we want to help those who are on the front lines. Adding to this is that the actual process for managing recalls within the pharmacy, it's more complicated than it needs to be often. So I think of it in the concept of the recall funnel. So receiving recall notices today, a single pharmacy organization can be receiving them from multiple sources and in multiple formats. They might be getting emails from their wholesaler daily. They might get physical mail or fax direct from a manufacturer. They could subscribe to, a recall broadcasting service. We've even heard of notices getting tucked into shipments so they can receive physical paper. So there's no standard data format. Often the notices themselves can be duplicative, and that's what feeds into the top of the funnel. There's kind of this chaotic mess of, what do we do with all these? Within the pharmacy, they're fortunate if they have a dedicated staff member who can take all these and organize them, but it's really dependent on the size of the organization and a lot of other factors. So moving down the funnel, next what we've heard is organizations will try to get one step ahead. Can we anticipate if we're actually impacted by the recall or not? So we have all these notices. Can we narrow that down? Can we look at something like a purchasing history? Can we run a report, typically done manually, but anything to get insight, because all while this is happening, patients are potentially on the line. And then moving down, once they decide what do they think is at high risk of a recall, impacting their organization, they need to actually physically sweep the shelves and find it. So we start at the top of the funnel, we narrow down as much as we can until we finally understand were we impacted, we find it, we retrieve that recalled product. And so all the while this is happening, critical patient safety is on the line, right? Going from one step to the next can take hours, it can take days, and every minute that product is left unretrieved, something bad can happen, right? In the best case, it's a poor use of pharmacy staff time because it's a lot of noise, it's a lot of extra effort. But in the worst case, it can turn into something serious, right? If a patient receives a recalled product, it could be harmful to them, or even if they believe they're under recall, but it's something that's not directly harmful, it can cause panic, right? Patients, doesn't make them feel good, So like I said, it's not usual that there will be a massive event that will cause fallout from a recall, but it does happen infrequently. It does happen, and it can have massive repercussions, particularly for a healthcare organization. So like I said before, we usually think of manufacturers being on the hook for recalls, but in fact there are cases where health systems have been held liable, and it ties back. So I'll talk about one of these, but in 2008, there was a recall of heparin, a blood thinner, and it was accidentally administered during anesthesia to somebody who was undergoing surgery. And unfortunately, the patient developed complication which resulted in amputation of part of one leg and one foot. And so there was a lawsuit, and the pharmacy had to prove that their system for managing recalls was watertight as best as they could. Again, this is in 2008, so tools have evolved quite a bit, but what they found was once product was received into the pharmacy, they were not tracking lot numbers. A lot of product had moved within the hospital to secondary locations, specifically Pyxis machines, their satellite pharmacy, to the operating room pharmacy, and to some specific like mobile stations that can hold drugs within the operating room. They had actually done 3 sweeps of all their shelves. They had gotten repeat notifications that not only they were under recall, but a warning that other similar health systems were struggling to handle this particular recall quickly. So they did 3 shelf sweeps, and they were unable to find a single product. So this ties back to, if we had the tools that are now becoming available with serialization data, they could understand the impact before they go searching. They could understand, if I've received this product, is it a lot that was under the recall? How many specific units of it have I received? That way, when they search, they'll know they have it, they have a number to reconcile against, and they can prevent something like this from happening. So, like I alluded to, this is kind of the vision we at TraceLink have had. If we have the data, can we create something that eliminates this concept of the recall funnel, funneling down the notifications, and just get you to what you care about, understanding the impact? Have I received this product, and get that information very quickly? So this is essentially what we started building. And the key to it is the EPCIS data. So if we think of the contents of an EPCIS file, you know what you received, you have information about the drug. Imagine if you can flag that with a recall, so when you receive product and you receive data, you'll know immediately, this is under recall, it affects our organization. So that's what we set out to build. Here's how we do it. So I mentioned that at the top of the recall funnel, these notifications can come in many different formats. There's no standard. TraceLink solves this. We have a team that takes analog or paper notices. This one shown is posted from the FDA website, and we digitalize the notice. We have a team that uses a combination of RPA and human intervention to pull things from these recall notifications, like the product description, the NDC, lot number, expiration date, and a few more things. But we turn that into a digital object that can be interacted with, something that could be queried against, a significant advantage and a missing step in the process today. The second thing we do is we build this constant flow of digitalized recall notifications. So right now, we check the FDA enforcement report, the FDA safety alerts. We also look at FDA market withdrawals, and we recently started surveying the California Board of Pharmacy for new recall notices. Our dedicated team in our network operations group extracts the data. Then we check recall notices to make sure they're not update duplicates. Sometimes the FDA might classify a recall at a later date or add lots. Our team will match these together so we have a singular digital object for each recall. We have an additional step where a human verifies it, and finally we publish it. So you could imagine 1,300 recalls just through the FDA every year. We are working around the clock to digitalize these and turn them into a recall database. And so step 3, it's pretty simple in concept, but it's very powerful in implementation. We take our digital recall database, we take a specific customer's incoming EPCIS data, and we check if there's a match. We match the product code and the lot number so that we can tell the customer, yes, you are impacted. And so a quick snapshot of it. Here's a snapshot of our UI. Using this tool can enhance anybody's recall management process. You'll notice that the UI is part of US compliance. It's not a separate recall system. It's not a separate solution. There's not a significant amount of training or time that needs to go into it. What you get is a recall impact report served to you on a platter. So a pharmacist, buyer, pharmacy technician, whoever is managing recalls, rather than dealing with the funnel, they can go here, they can see which recalls have come in. If the evaluation result is marked impacted, they download a report and they can see where did I receive this product, when did I receive it, and which quantities were sent to which locations. So back to my example with the heparin, if you have a number that you know you need to reconcile against when you search for a recalled product, you can ensure that you get the job done and you get it done quickly. So when we tie it together, what our tool does is a recall process accelerator. The benefit that you get from that is, of course, you maximize patient safety because you're enabling organizations to remove recalled product off the shelves as fast as possible. You're demonstrating, as a pharmacy organization, a high standard in case there were ever to be, a legal situation where you need to defend your process. We have a report that can support you there. And then, of course, it returns staff time to busy pharmacy staff who, frankly, would rather be spending their time providing patient care rather than managing the recall funnel and all of its chaos. So we brought our targeted recall solution to market about 6 months ago. We ran a workshop with one of our strategic customers. So the purpose of this slide is to just give you an idea of the impact it can have across an organization. So we worked closely with a regional health system. They have 3 hospitals in their network and a handful of other clinics. We sat with them and we investigated every single step of their process, every single step of the funnel, who is doing the work, who are doing the shelf walks, how long does it take to accomplish each step. And what we were able to do is provide them a savings report. So the top graph is the total cumulative amount of staff hours taken to manage recalls for their organization in a given year. It's roughly a 25% saving using our tool, which equated to 8,008 annual hours returned to pharmacy staff. So we have some pharmacy folks here. I'm sure you can imagine if you have that much time, if you have any time that you could give back to your staff rather than working on recalls, what would they be doing? 8,008 hours. And then the second piece is we looked at the actual cycle time reduction, cycle time being the definition of when an organization receives a recall to the moment that they close it out. We looked at how much can we reduce that frame and in turn enhance patient safety. So by working with them, we established an agreed upon value, 55% time reduction from the moment a recall is received to when it's cleared off the shelves and closed out. That's a 55% reduction in the chance that a recalled product reaches a patient, 55% reduction that the organization is at risk, better use of staff time, and just overall a better way to manage recalls. So thank you very much. I hope if you take away anything from the presentation, it's these 4 things. First, again, recalls are ever present. They will never go away. We should be thinking in the mindset of how we respond to them. Second, we are finally, with the emergence of EPCIS data, able to add this layer of intelligence on top of recall management processes today. EPCIS is that critical missing component that we are now providing with our targeted recall solution. And then I invite people to also think about what's next. This is a rock solid application of what we can do with the data now that it is emerging. What else could we use the serialization data for to improve other processes in the supply chain? Thank you. All right, do we have any questions? All right, I see one.
Manufacturers or MAH?
Yes, like from my early challenge slide. Yeah, so we right now, we do not have a solution that is targeted for the manufacturers, but this is something that we've been thinking about, and we've actually heard from a couple of our customers recently, manufacturers specifically. A few times they've faced recalls and they've said, TraceLink, is there something you could do to help? Now that the serialization data is emerging, what can we do? So this is an ongoing conversation. Not a solution today, but we're absolutely open to continuing the conversation. So, All right, I see we have our next speaker. I will make a quick plug. We have a targeted recalls roundtable coming later in the session, so if you want to talk recalls, we could keep it going. All right, thank you.